Good afternoon, everyone. Thank you for joining us for this virtual release of our 2019 Fatal Overdose Victims and the Criminal Justice System report. We're very glad that you're here with us this afternoon. I am Sharm Allen, Knox County District Attorney General. I'm very fortunate today to have three community experts with us on the subject of overdoses and overdose deaths in our community. Our first panelist that will be joining us is Karen Pershing. She is the Executive Director of the Metro Drug Coalition. Thank you for being here with us this afternoon, Karen. Next, we have Samantha Monday. Samantha is the Substance Abuse Case Manager for the Knox County Sheriff's Office. So thank you for being with us this afternoon, Samantha. And last, but certainly not least, we have Amy Delinky joining us this afternoon. She is the All for Knox Substance Misuse Response Coordinator. Thank you for being here with us as well, Amy. Well, today, what we're going to do is talk about a report that we here in the District Attorney's Office have released dealing with fatal overdoses and folks that have come through the criminal justice system here in Knox County. The reason that we are doing that release today, part of the reason is because today is Overdose Awareness Day. And we wanted to acknowledge that day, and we thought that that would be a very appropriate day to bring community partners together to have a discussion around overdose deaths and how to prevent them in our community. So we really do want to focus on all the things that are going on, all the available options, the things we're doing as community partners to try to cut the number of overdose deaths here in Knox County. In the District Attorney's Office, we obviously prosecute those folks who bring drugs into our community. But as we began to really work on overdose death cases, it became very apparent to us that we needed to do more than just prosecute. We needed to be very involved in the prevention part of addiction, and that we also needed to be a good team player, a good community partner in the treatment realm here in our community, because it really does take all those things to make a difference: prosecution, prevention, and treatment. So as we began to realize that, back in 2017, we started here in our office an overdose death task force. The purpose for starting that task force really was to bring together law enforcement agencies to work on being able to investigate every single overdose death, not only as just an overdose death, but a potential crime scene. We wanted to be able to make homicide charges in any case that we had where someone had lost their life and we thought we could find the person who supplied those drugs that took someone's life. So we started that in early 2017. It really was spearheaded by Appalachia HIDA, which is the Appalachian High Intensity Drug Task Force Agency. It's a federal agency that came into our community. And on the task force, the partners are numerous. The partners are obviously the HIDA task force, our office, the TBI, the Regional Forensic Center, the Knox County Sheriff's Office, the Knoxville Police Department, and many other community partners in law enforcement that work with us. As we began to work on this task force, we saw that we were able to prosecute many homicide cases and charge a lot of deaths where we were able to go up the drug supply chain and start charging folks that were supplying drugs into our community with homicide charges. But in the process of doing that, we realized we were gathering enormous amounts of data. And we began to collect that data and take that data component to try to put it together in some type of report that community partners could use in their efforts as we all work together to try to combat the problem of overdose deaths in our community. And what we found was we were pretty successful. We were able to charge a lot of homicides, as well as overdose death numbers in our community started to go down. The numbers really went down last year. We were very high the 2 years preceding that, but we made a significant impact last year and our death numbers had gone down significantly. However, COVID-19 this year has caused those overdose death numbers to go back up significantly. And just to give you an idea, last year at this time in our community, we had lost 170 individuals to overdose deaths. Currently, as of today, we have lost 218 folks to overdose deaths in our community. So the number is on the rise, and I think that's probably directly related, unfortunately, to COVID-19. What we want to do is look at some of the data from the report, and as you'll see on your screen now, you have probably the biggest piece of data from the report for us. And what you can see is over the last 4 years, from 2016 through 2019, we cross-referenced all the individuals who suffered an overdose death with those that had come through the criminal justice system. And what we really see is about half of the folks that are dying in our community due to overdoses have been involved in the criminal justice system sometime within the 5 years preceding their death. So what that's really told us is that the criminal justice system is an intercept point. Half of the folks that are dying, we are seeing here in the criminal justice system. So we know that not only are we prosecutors, but we are also that point where we can get involved in trying to help some of these people and do treatment and do prevention. So that's been something that we have focused on based upon the data from this report. You'll also see how quickly folks are overdosing fatally after getting out of jail. You'll notice that it's run anywhere from 20 to 30% of the time that 20 to 30% of the folks that have died within 1 year of getting out of jail. So it's pretty quick. It's a quick turnaround. So it's hard on us in the system knowing that such a significant number of the people that we come into contact with and my assistant district attorneys come into contact with have a really high probability of dying from an overdose. We also learned that there's a percentage of them that are only in jail for just a short period of time. It's not like all of the folks that are overdosing have lengthy, long criminal records and have spent a lot of time in our system. That's not true. Many of the folks that are overdosing have only been with us for a week or less. So we are definitely an intercept point. Some years we're a little higher than 50%, some years we're a little less than 50%, but we're always right around that halfway mark, knowing that we are an intercept point. We have gathered other data for our report, and that other data can be found in detail in the report, which is found on our website and our social media. Some of that information is information that we have gathered at the request of our partners, and they are things like the sex, the race, the ages. We go into things like that, the individuals that have come through our jail and the individuals that are now dying of overdoses. So all that data can be found, but this is the critical piece that we really wanted to talk about before we turn to our community partners. So let's go back and have a conversation now with each of our community partners and ask them to give us a little bit of information about their particular organization, what they do, and how they've used our report and our data to aid them in their work. And first, we'll start with Karen. Karen Pershing, as you'll remember, is the Executive Director of the Metro Drug Coalition. And Karen, can you tell us a little bit about your organization and the report?
Sure. Thank you, General Allen, and I appreciate the opportunity to participate in this discussion today because, again, it's an extremely important one on a very important day. Metro Drug Coalition has actually been in the Knoxville community for over 34 years now, and our focus has been on primary prevention around substance misuse. So again, trying to stop the problem before it starts. Unfortunately, the opioid crisis really caught, I think, a lot of us off guard, and it was a whole different problem to tackle. And we started seeing the numbers hugely increase with the opioid epidemic of people with addiction issues, as well as those overdosing and dying. And I can tell you from the point that I started looking at data when I came here 10 years ago, I could tell you there is very little local data available on the opioid problem and addiction in general. I could find a lot of national data, some state data, but local data was just very hard to come by. And so we've really built a lot of community collaboratives within Knox County, such as this one, that allows us to dig a little bit deeper here locally and figure out really where our problems are and where our intercept points can be. Because as you mentioned, General, you know, about 50% of the folks who have died have touched the criminal justice system. So again, there are things we can do within that system to possibly intervene and prevent those deaths from occurring. But that's only going to save about half of the folks who are dying. So as a prevention organization, we have to look at where are those other intercept points, you know, the healthcare system, friends, family members, workplaces, all of those folks who may be in contact with folks who start showing signs that they're veering off and having trouble with substances, but may not be that far down the path yet. And so the earlier we can intercept the disease process with addiction, the better off we're all going to be as a community. And so, again, we have resources at Metro Drug Coalition to help with this. We have a regional opioid prevention specialist that can train people on how to use naloxone, which is an opioid reversal drug, and can provide the naloxone for people free of charge. There's also a 24/7 helpline where people can get help if they're ready to get into treatment. We also have a recovery housing fund that helps people who are coming out of treatment and need additional support. We're doing recovery coaching. There's just a lot of different pieces that we've added over the last several years to try to strengthen our primary prevention work in keeping people in long-term stable recovery as well. Because as you mentioned, a lot of those deaths are occurring post-incarceration too, once they're released. And so anything we can do to identify folks as they're exiting the criminal justice system, make sure that their friends and family members know how to access naloxone, have naloxone available in the event someone relapses, the better off we're all going to be, and we'll be able to drive those numbers down. I would strongly suggest that if you need information on any of those resources I mentioned, that you visit our website at metrodrug.org, and you can navigate on that site pretty easily and find all kinds of resources available to you. And please get in touch with us, and we're happy to help with education training of all kinds. We pretty much tailor our trainings based on your needs. So thank you again for this opportunity.
Well, thank you so much, Karen, for being a community partner with us. And just briefly, I know that something that is near and dear to your heart and something that Metro Drug Coalition is working on is the Gateway. Could you tell our listeners just a little bit about the Gateway and where we are in the progress with that and what it is?
Sure. Thank you for asking. The Gateway is actually going to be a recovery community center here in Knoxville. So it'll be a centralized physical location located on West 5th Avenue in Knoxville, where we can have coordinate efforts with multiple community partners under one roof to better serve people in recovery. Because what we know from addiction science is it can take anywhere from 18 to 24 months for an addicted brain to fully heal. And so most people only get maybe 15, 30 days of formal treatment. And so their brains are still extremely vulnerable to relapse until they can fully heal and re-engage. And so if we can keep them connected to supports that they're going to need until they can make better decisions for themselves, the better off we're all going to be. And that's why we're seeing some of the overdoses in our community right now due to COVID, is because we've had to shut down some of those social connection and resources that people normally would have to others in recovery. And so we're raising the money right now to try to rent as soon as possible. And you can find out all about that on our website as well. But we'd love to have anyone who's interested to reach out to us, and we're happy to tell you more about the Gateway.
Okay, thank you, Karen, and thank you for being a fantastic community partner. Here in the prosecutor's office, we're excited to have a place to be able to send folks from the criminal justice system into a recovery community. And there's not anybody that knows more about sending people from the criminal justice system out into the community than our next guest, which is Samantha Monday. Samantha is the substance abuse case manager for the Knox County Sheriff's Office. And Samantha, if you could tell us a little bit about what you do, what you see, and the interactions between the criminal justice system and those that are overdosing.
Thank you, General. I have a very unique job in that I kind of play monkey in the middle, for lack of a better term. I work inside the court system with the ADAs, with the defense attorneys, and with the treatment center as an advocate for the client of mine who happens to also be an inmate. So I do a full biopsychosocial assessment with them to figure out what their needs are, and then also work with the probation officers to try to get them everything they need within the confines of the probation that they're going to be on. So it is quite the task most days, but I do love what I do. I get to work with a lot of community partners. I utilize many resources in this community. I use a lot of grant-based services and a lot of safety net services for mental health folks. So Centerpoint, Jelnick, those are my two go-to because they're grant-based and they are in Knox County. I also utilize Peninsula and Cherokee and Helen Ross McNabb for other services as well. A big problem we run into is we just don't have enough beds, which I think most of us are aware. There's just not enough. And unfortunately, due to COVID, that has actually shrunk down the amount of beds that we have available to us. And conceding to the detox folks that are coming in are getting a lot of our beds. Not saying that that's a bad thing, but that's basically what I do. I have a partner who also works with me. So we cover the vast majority of the courthouse now between criminal court and sessions court. So we're on the phone all the time and trying to keep everybody in the loop and make sure that our inmates are set up for success when they leave. So that means putting them in supportive sober housing. That means making sure that they have medication that they need. That means making sure they have that appointment that they need for mental health or an IOP or whatever it is that they need. And so we try to do what I refer to as a warm handoff to wherever they're going, so that the person that they're going to that's going to be their counselor, say at Jelnick, is aware of this person's ups and downs and their triggers and what's going on with them, so that they're not blind when this person shows up, which also makes that client feel warm and welcome when they arrive. So that sets them up for a bit better success. Some issues that we can repeatedly, I would say, run into is the lack of funds for supportive housing deposits. I do call MDC frequently and try to utilize that resource. We use some grants through TDOC for our RHP DRC folks, but frequently there's just not enough funds available for those folks. And unfortunately, it takes me a little while sometimes to locate it, and they sit in jail while they're waiting. Which is not the best scenario, particularly if it's somebody who just completed treatment. The worst thing in the world clinically is for them to come sit back in a jail cell with an inmate who's fresh off the street and fresh, from using. So that's an issue that we face all the time. But there are more and more resources popping up. I'm hoping that this data helps that. For us here at the Sheriff's Office, I personally have utilized this data at least twice, writing 2 different grants. One of those that we wrote actually provided us with an employee. That grant was through the Department of Corrections. And what that did was add a position to work with ITP. So that adds for an additional resource for our folks who are in treatment here in the jail. Another grant that we wrote, unfortunately, we didn't get, but we're going to keep pedaling forward so that we get more grants to provide more resources inside the jail. Most people don't realize how many things we do inside this jail to try to set folks up for success. We have an ITP, or an intensive treatment program here, that's 90 days long, which is 3 times the length of the average treatment out in the world. So they're a captive audience, so they get to work on stuff. In the morning they'll have group, and then they do some groups on their own in the evening and kind of compare notes and work on their homework and that kind of thing. We also have a faith-based program here at the jail that is also a 90-day program called Focus, and Focus Ministries does a great job. They also have a sober living house that they transition people into as well, so that's a great thing. We also have all kinds of things. The YWCA comes in and does groups focused on sexual trauma victims. We have NA meetings, AA meetings, Celebrate Recovery, church. We have fatherhood classes to help teach parenting classes to our male population. We have a Humvee program that houses veterans or folks who were in the military at some point in their life. So it puts them cohabitating together so that they have similar experiences and they can share and support one another. And we have some programs that go on in there for them as well, like anger management. So we're constantly trying to evolve here in the jail to give these people some more resources, more guidance, to set them up when they leave. So they're making some connections with churches and folks who run NA groups in here and out in the community. And so that is a great connection for them in their transition out. Now, I will say, unfortunately, due to COVID, some of these programs aren't going on. We don't have any volunteers coming in right now, but hopefully sooner rather than later, we get everything going again.
Okay, thank you, Samantha. And thank you for touching on some of the things that are going on inside the Knox County Jail, because a lot of times I don't think that people in the community realize that there's actually treatment that's begun in the Knox County Jail. So thank you for touching on those points. And I know that you've reached out to us a couple of times and asked for us to gather specific data so you could apply for grants. So that's a very valuable partnership between the District Attorney's Office and the Sheriff's Department. So thank you for your work, and thank you for being with us today.
Thank you, ma'am.
That brings us to Amy DeLinky, and Amy is the All for Knox Substance Misuse Response Coordinator. And All for Knox is something that Amy will describe in detail to you, but I am very fortunate to have been a justice system sector leader for All for Knox, along with Chief Eve Thomas from the Knoxville Police Department and Special Agent in Charge Tom Bivens with the DEA. So we have been working with Amy now for quite some time, and we're very fortunate to have her kind of rallying all the troops in our community sector-wide. So Amy, if you could explain to our viewers what it is All for Knox is, what you do, and how our data has helped you.
Yeah, thanks for having me, General Allen. So when we're looking at All for Knox, and definitely appreciate all of your leadership in that sector as well, we engaged 9 different sectors throughout the community. And All for Knox began in 2018. It was spearheaded by both Mayor Jacobs and Mayor O'Hara at the time, and Mayor Kincannon continues to carry that through. And the goal is to really address substance misuse or the substance misuse epidemic here in Knox County. And the initial partners with All for Knox were Metro Drug Coalition and the Knox County Health Department, as well as the District Attorney General's office. So there was an initial summit that took place where the group decided that they really wanted to have this countywide strategic plan, which is that was prior to me coming on board. And so in 2019, the second summit took place, which was really the kickoff for our community-wide strategic planning process. And that involved those 9 different sectors, which are business, education, faith-based, family and community, government, healthcare, justice systems, nonprofits and service organizations, as well as treatment, recovery, and harm reduction. And the reason that the 9 sectors are utilized is because this is not a problem that one group or one organization or one sector alone can solve. So what's really critical is that we all have a role to play in addressing substance misuse and the impacts on the individuals and families, really in our community as a whole. And so those sectors met for the first time at that 2019 summit, and then continued to meet monthly to really start building a community-wide strategic plan. And they met monthly up until the pandemic began. And so at this point, we've re-engaged those individuals in a virtual capacity, but there was a bit of some downtime there. But what's really important is that even during these difficult times, events like this event today, and the ability to re-engage folks in the strategic planning process, there's so many people here that recognize the importance of addressing this even during a difficult time, or even more so during a difficult time. So the justice system sector specifically used the data from this report and previous reports to really start looking at some really big picture items. So the recovery housing funding that has been spoken about already, that is something that we are moving towards increasing funding opportunities for through different grant options, as well as an overdose fatality review team for the county. So those are things that we're moving in that direction for, that would allow us to really expand on the data that's been collected and dig in not just to individuals that have been impacted through overdose and have come in contact with the justice system specifically, but to be able to identify what are those intercept points, what are the opportunities for intervention or harm reduction or prevention in our community by looking at those that we've lost and the people around them. But I did want to share a couple strategies that the justice system sector had developed that I thought really were relevant with the data that's been collected, and where some of the passion for seeking out new data really came from. So the first of those is to reduce stigma and increase awareness in identifying individuals with substance use disorders and co-occurring disorders across justice systems. And so this is really about understanding where those interactions are taking place between individuals and the justice systems that exist. And this will provide an opportunity for education. This will provide an opportunity for prevention, a lot of different ways that we can step in and assist individuals there. The second one I wanted to share is about increasing access to diversion and justice system referral or inclusion of treatment and recovery resources within the justice systems. So it's great to know that these things are already happening, but how can we look at potential expansions of some of those things, looking at the different types of recovery programming and supports that are available, looking at specialty courts and things like that. So I really felt that the justice system sector started with a great amount of data, even in comparison to some of the other sectors, because of this report that you guys have put out in previous years, really allowing them to say, what is the picture that's currently a part of our community, and how do we shift that picture moving forward, or what other data do we need moving forward to better support those in our community. So we're really excited to continue moving forward, to continue all these partnerships, and the goal is that the All for Knox community-wide strategic plan will actually be released this fall.
Thank you, Amy, and you have certainly taken on a Herculean task with the All for Knox initiative, and you've done a fantastic job, so we thank you for that. Once again, our purpose really today is to talk about the report, show you that we as the District Attorney's Office are very conscious of our role in the entire overdose death perspective or picture community-wide, and we'd like to encourage everyone to be very conscious of their perspective. And to highlight that we have a shortage of data in our community. And so really it's just to get everyone thinking about what role do I play? What role does my agency play, my business play? What role do I have as an individual in the overdose death crisis that we are experiencing here in Knox County? And what information do I have? What data? It doesn't have to necessarily be data. It may be information that's very helpful to community partners, because the overall takeaway is the more that we work together and share our information and share our data and rely on community partners, the better we will do as a community in being able to tackle this problem and lower the number of overdose deaths. And as we talk about overdose deaths, we'd be remiss if we didn't really point out that we are talking about the loss of life. This really is more than just data. It's really more than just numbers. I said earlier that as of today, we have 218 suspected overdose deaths in our community. That's 218 lives lost. That's 218 funerals. That's 218 empty chairs at the next holiday. That's mothers and fathers and sisters and brothers that have lost children, lost parents. This really is a personal issue to so many individuals in our community. Even though we're gathering and collecting data, it's so much more than that. It is the loss of human life, and we are collecting that data to try to do a better job of preventing that loss of human life. One of the things that we have as part of the overdose task force that I mentioned earlier is an overdose support group. It's available for all the family members of everyone who has lost their life to overdose. And that community support group is run by Tracy Smith in my office. She does a phenomenal job running that support group, along with a member of the Knoxville Police Department. And that particular support group will have a candlelight vigil tonight here at the City County building. That candlelight vigil will start at 6:30. Anyone is invited to attend. The group participants will be meeting at the Hill Avenue entrance to the City County building. And face masks will be required. So please, anyone who's interested, please come and support that group as they have a candlelight vigil tonight. And I believe, Karen, there's also a virtual thing happening tonight that you may be able to tell us more about.
Yes, General Allen. Normally there's a huge community event that has been happening here for several years, where there's a huge gathering of folks in recovery or families and individuals who have lost loved ones. And there's a candlelight vigil that follows that, and it's in person. But it usually draws a pretty big crowd. And so this year, the Tennessee Overdose Prevention Network, who sponsors that event, has chosen to do a virtual candlelight vigil. And so that will be at 7:30 this evening on Facebook. And so it'll be a Facebook Live event. You will have to register for that event and get the link, Facebook link sent to you in order to participate. But I'd strongly encourage anyone, especially those who aren't getting out and about in the community due to fear of COVID. You know, this is a way you can participate virtually and honor those whose lives have been lost to overdose, but do it in a safe manner.
Okay, thank you, Karen. And so that is a live in-person event that is happening tonight, as well as a virtual event. So please take time this evening and join one of the two events, whichever you're more comfortable with. At this time, I'd like to just say thank you so much to each of our participants here this afternoon. And also, I'd like to say thank you to our task force members who work on our task force, as well as my staff who works diligently on this report and gathering data each and every year. I'm hoping that we have sparked an interest in some new community partners who will be joining us in the future. Please reach out to us. Any information that you would like to find on anything that we've talked about today is available on our social media, as well as our website here at the District Attorney's Office. Thank you, ladies, for all the work that you are continually doing for our community. We greatly appreciate it, and we appreciate your involvement today. Thank you.